Good afternoon. Welcome to First Local for Tuesday, November the 3rd. Thank you very much for joining us this afternoon. We're waiting for Premier Doug Ford's press conference. Today he's joined by Christine Elliott, who's the Deputy Premier and Minister of Health, as well as Rod Phillips, who's the Minister of Finance, and Dr. David Williams, who's our Chief Medical Officer of Health. This is coming to you from Queen's Park, so we'll be taking you there shortly. But before we go over to Doug Ford, we're going to go over to Weather Daniel. What's going on in the weather there, buddy?
TV Weather Minute for Tuesday, November the 3rd. It's election day for our U.S. friends, so make sure you get out and vote. We'd like to thank all our Michigan viewers as well. And let's take a look at our camera today, which is brought to you by wirelesscom.ca. And yes, we've seen a mix of sun and cloud throughout the day. That's going to continue. We are going to see some clouds move in overnight, and the temperature drop to about 4 degrees, but not too much going on. And look at this, Wednesday, Thursday, and Friday, a mix of sun and cloud. We're getting up to 17 degrees by Friday, and then that's going to continue through the weekend before clouds return, and then rain on Monday, 17 degrees though, well above normal, back down to 9 on Tuesday, and then we will see overnight lows stay in the high single digits most of the week. This has been your On TV Weather Minute. Have a great day.
And welcome back. Thank you very much, Weather Daniel, for that update. Looks like things are going to get a little nicer in the near future. We're actually going to probably be above zero for a bit, so that's nice, since we've had snow the last couple days. Alrighty, so Algoma Public Health is confirming 2 new cases of COVID-19. This is case 45 and 46. One case came from close contact. The other one came from international travel. Both were tested on November the 2nd, and the test came back the same day. They have notified all the close contacts of both individuals. So if you haven't been contacted by Algoma Health yesterday, you were not one of the close contacts. Now, on the American side, cases continue to grow there as well. We have the numbers. These are the numbers for Saturday, Sunday, and Monday. They have 13 new confirmed cases over 3 days, 0 new probable cases, and they had 2 new recoveries. This means they've had a total of 201 cases. 88 of those have recovered. That leaves 113 cases active on the out in Chippewa County on the Michigan side. Now, Rexall has run out of flu shots. We mentioned this morning. Rexall pharmacies have been doing the flu shots across the province. Their supply of the flu shot is completely out. They're trying to get more. So right now, if you want to get a flu shot here in Sault Ste. Marie, what you need to do is call the Algoma Ontario Health Team. And you can call them on Tuesday or Wednesday nights from 5 to 8 p.m. You can go to our website to find out the number as well. I'll give it to you in just a sec. But this is to schedule going to GFL Gardens in downtown either Friday or Saturday to get your flu shot. But you have to have an appointment. You cannot just show up. And so tonight and tomorrow night between 5 and 8, you can call the Algoma Ontario Health Team, and their number is 705-759-7486. That's 705-759-7486. And it's between 5 and 8 p.m. tonight to give them a call so that you can book a flu shot on either this Friday or this Saturday. They will also be doing it again next weekend, but you cannot call for next weekend until next Tuesday and Wednesday. Now, there is an art exhibit that is starting in downtown Sault Ste. Marie. This is called the Art X Project. It's on November 5th and 6th. It's a joint venture between the Rolling Pictures, the City of Sault Ste. Marie, Future Sault Ste. Marie, and the Downtown Association. It's taking place at Rolling Pictures facility downtown. You do need to go onto Eventbrite and book a ticket ahead of time because they can only have up to 20 people at a time inside the art exhibit. So you book a time there. You can go to our website, just look for the Art X Project event on November 5th and 6th, and you can link through there to the Eventbrite page to book your ticket if you'd like to go. It has a couple of our local artists, including someone who actually works here at Sault Line and on TV as well as showing his art down there as well. So congratulations to Aaron on that. Alrighty, moving along. Jeepers. Just when you think Trudeau may finally get out of being in some sort of ethical violation, they just keep going back to the Ethics Committee in the House of Commons. This one was defeated. It was to study both Prime Minister Justin Trudeau and his wife, Sophie Trudeau, their speaking contracts since he was elected to Parliament. This is the second attempt to probe their speaking contracts. It was voted down. There was also a similar motion recently about the We Charity speaking contracts involving Trudeau and his wife that also didn't pass, so they're not investing in that either. However, they're still debating a third motion. This one is from NDP MP Charlie Angus to study possible conflicts of interest and lobbying violations in relation to pandemic spending and the deal with the We Charity to administer the student volunteering program worth hundreds of millions of dollars. So, one more ethics violation possible looking into Trudeau's past with the We Charity. That's not the first time they've tried to look into the We Charity where it's been voted down, so we'll see if it goes through this time. Moving along, just a couple different things here. First off, the Harvest Algoma United Way, they're doing a campaign, obviously, this time of year, and the Relevant Life Financial Group is encouraging businesses to donate food. You can actually tag yourself online. They'll put you into their Facebook campaign. They're asking for, if you donate $10 or more, you'll receive a charitable donation. They're asking companies to do like a casual Friday where everybody brings in some non-perishable food item, and then they will donate it to Harvest Algoma. And you can have a casual Friday, things like that. Take office pictures and send it into them. You can bring your donations to the Relevant Life office. It's at 71B Spring Street, and that's between 9 a.m. and 3 p.m. Monday to Friday for the month of November. Or if you'd like them to come and collect it, just call them. You can get the number on our website, but it's 705-998-2910. That's 705-998-2910. And obviously, at this time of year, the food bank and other organizations greatly appreciate any food donated. Now, we're going to go over for some more news with Mike McDonald. What's going on, Mike?
Algoma Public Health is confirming 2 new cases of COVID-19 in the district. One case subject is tied to international travel, while the other is classified as a close contact case. As of yesterday, both are said to be self-isolating. APH notifies all close contacts directly through contact tracing. If Algoma Public Health doesn't call you, you are not considered a close contact.
We're going to win the state of Michigan so easily. We want to do it just like last time, but let's give me a little bit more margin than that, if you don't mind.
Canadians are watching in fear today as their American neighbors vote, capping a campaign marked by voter intimidation, threats of post-election violence, and concern about the potential breakdown of democracy itself. That view is reflected in a new poll from Leger and the Association for Canadian Studies that found a clear majority of Canadians surveyed worry that the U.S. will suffer a breakdown of its system marked by social chaos if no clear winner emerges. That fear is being driven by the assumption that U.S. President Donald Trump will not accept defeat if he is in fact defeated, or may prematurely declare victory on election night before all votes, including mail-in ballots, can be legally counted. The Leger poll found that 3/4 of those surveyed in Canada are worried about the U.S. election, and 68% worry that there will be a complete breakdown of the political system in the U.S., leading to a period of social chaos. A soon-to-open tattoo business was the victim of a break-and-enter late Halloween night. According to Ascension Inc. tattoo owner Gary Dark, the total amount stolen was around $3,000. The suspects went through 2 doors in order to access the shop, including a steel door. Stolen items include a computer, decorative knife, and bear art.
And now we're going to go over to Doug Ford's press conference. Here we go.
Well, good afternoon. As a province and as a country, we're grappling with a new reality. And it's becoming more and more clear that COVID-19 will be with us for a while. It's why we remain vigilant. It's why we continue to adapt. We continue to plan for the long game. And today, we're taking an important step forward. We're implementing an early warning system with clear criteria to help inform when restrictions should be tightened or loosened on a regional basis. We're giving you a clear understanding of where you are as a region, because I know that you want access to more data. I know you want predictability. Today, we're releasing our province's COVID-19 response framework. This framework was developed in consultation with the Chief Medical Officer of Health, the Public Health Measures Table, local medical officers of health, and other health system experts. This planning framework provides structure. It will help inform decisions on a regional and province-wide public health measures based on the data we're seeing. The framework will also provide more certainty to businesses, families, and workers. It will help us introduce preventative measures early to slow the spread, early interventions that will help us avoid more restrictive measures like the shutdowns and lockdowns we're now seeing in more and more countries around the world. It takes a gradual approach to public health measures, cautiously escalating or reducing restrictions as we see changes in the local data. We will stay on top of the trends to determine where regions stand. And thanks to the revised framework, we can start to transition regions away from modified stage 2 restrictions, which were always intended as short-term measures. Based on current trends and the advice of the Chief Medical Officer of Health, we're prepared as of Saturday, November the 7th at 12:01 a.m. to move Ottawa, Peel, and York region to restrict level. This means gyms and indoor dining will be open with the capacity limits and restricted hours. Mayor Tory has asked us for a little more time in Toronto, and as always, I will support him. At Mayor Tory and Dr. DeVilla's request, Toronto will move to the restrict level a week later on November the 14th. Eastern Ontario will also be moved into restrict level to address concerning trends. Brant, Durham, Halton, and Hamilton will be moved into the protect level as we add preventative measures to slow the spread of COVID-19 and keep these regions from needing more restrictions. All other regions will adopt the prevent level. Our health experts are still reviewing the data and will confirm the alert level for each region on Friday. We're going to continue to provide regular updates each week, and thanks to Minister Bethlenfalvy, we have a brand new dashboard on COVID-19 website to provide that important information. This brand new dashboard, it's great news. It will allow you to see exactly where the trends are going. You will have the access to the exact same public health data and information as I do, and I want you to see what I see. This information will be updated daily. It will give you a direct line of sight into hospital beds, ICU capacity, test positivity rates in your region, because it's critical that everyone has the access to this information so you can take the necessary steps to protect yourself, your family, and your community. By taking these steps today, we'll be in a stronger position to handle the second wave and the future ones. Together, we can keep COVID-19 at bay and fight to get back a little more of our normal lives. And right now, that's worth everything. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. Since the start of this outbreak, our government has not wavered from our commitment to make the health and safety of Ontarians our #1 priority. We've had to make decisions, often very difficult ones, that profoundly affect people's lives. With severe lockdown measures being imposed across the world, we are now at a pivotal point in the pandemic. We know that this crisis is going to continue on, so we need to assess our actions to date and adjust how we make decisions moving forward. Our COVID-19 response framework was developed in consultation with the Chief Medical Officer of Health, the Public Health Measures Table, local medical officers of health, and other health experts. The Keeping Ontario Safe and Open framework ensures that public health measures are targeted, incremental, and responsive. It takes a scalable, gradual approach that includes introducing less invasive preventative measures earlier to help limit the spread of transmission and avoid broader closures. This approach is also targeted, with each level having measures for specific sectors, institutions, and other settings. At its heart, this framework takes a comprehensive whole-of-government approach and lays out how we can act earlier by implementing measures to protect public health and prevent future closures. This includes testing, case and contact management, compliance and enforcement, scalable public health measures, and supports to affected individuals and businesses. All of these measures will be essential to limit the severity of the second wave. Implementing select targeted measures earlier will help reduce COVID-19 transmission and prevent significant economic impacts and job losses by avoiding full lockdowns. Enhancements are also being made to our website for information on COVID-19 to inform and engage Ontarians on the status of the virus in each region of the province. We are continuing to expand access to real-time data. Information about local spread of COVID-19, public health and health system capacity will now be available on ontario.ca/coronavirus. This includes local cases by public health unit regions, the total number of cases, resolved cases, deaths, as well as tests completed and how many are positive. This information will help to better support businesses, organizations, and local communities, allowing them to prepare in advance for any changes in their region. We are committed to being transparent with Ontarians, businesses, and local communities as we continue to work together on our shared goal of stopping the spread of COVID-19. I once again want to encourage everyone to please maintain physical distancing, wash your hands thoroughly and regularly, wear a face covering when physical distancing is a challenge or where mandatory to do so, and stay at home when you aren't feeling well. By following this simple advice, we can protect one another and reduce the spread of COVID-19. Thank you, and I'll now pass it over to Dr. Williams.
Thank you, Minister. Good afternoon. The COVID-19 response framework lays out a proactive and graduated response to the situation in each region of the province. This means that additional measures and restrictions will be applied in higher risk settings based on the severity of disease transmission in a region. As the pandemic has progressed, we have learned more about COVID-19 and how it spreads. Our public health measures, including physical distancing, people staying home when ill, even with mild symptoms, and limiting the number of people that come together, are all intended to reduce our number of close contacts. We know that there are other measures that can further reduce the risk of transmission, minimize the impact of super spreader events, support compliance with the rules, and make case and contact tracing easier. The COVID-19 response framework includes these additional measures that allow businesses and other settings to operate while working to limit spread. It also implements select targeted measures to help avoid closures and full lockdowns. While closures are sometimes necessary to interrupt the transmission of COVID-19, we recognize their harms, including to people's income, employment, and well-being. As a public health physician, I know that these are important determinants of health and need to be considered in our response. We also experience the challenge of school and child care closures and restrictions in long-term care homes in the spring. We know that those actions had an impact on the mental health and well-being of children, seniors, caregivers, and our communities. Avoiding the need for these types of closures is critically important. This can only be done if the public health measures and restrictions are complied with, both by individuals and businesses. And while it's important to support local businesses, we need everyone to recognize that risks remain, especially in crowded places, in enclosed spaces, and where there is close contact. That is why people should continue to follow public health advice and limit close contact to individuals in their household and even in public settings. We, as individuals, families, and businesses, all have our role in keeping each other safe. I will now pass things over to Minister Phillips.
Thank you very much, Dr. Williams, and thank you to you and your whole team for all the great work that you've been doing on behalf of the province. On Thursday, as you may have heard, we'll be releasing our 2020 Ontario budget, the next phase of Ontario's action plan. It'll provide a multi-year outlook that builds on the $30 billion response to COVID-19 that we first outlined on March 25th. Recognizing, as families and businesses do, that especially during this period of uncertainty, it's important that we have thoughtful plans. The next phase of Ontario's action plan will make available every resource that is necessary to continue to protect people's health, and it will expand on the support our government has been providing for those still facing financial hardship as a result of the pandemic, including families, workers, vulnerable people, seniors, and employers. The plan will have 3 pillars, and yesterday we announced the first pillar, Protect, which is making good on Premier Ford's commitment to the people of Ontario to do whatever it takes to get through the pandemic. The second pillar is Support, because we know that COVID-19 has brought severe challenges and economic difficulties to families and employers. Since the beginning, we have promised to be there for those who are struggling most, and my budget on this Thursday will outline our plan to build on the initial response to COVID-19, including the $13.5 billion of direct support for people and jobs and $11.3 billion in cash flow relief. That's money that will support seniors, vulnerable people, parents, workers, and small business owners. Now, in addition to the news we have today, the important news about the public health approach, there's also other news we want to speak to you about the vital part of the support pillar, which is the $300 million we're making available to assist businesses impacted by the difficult but necessary decisions to impose new public health restrictions. This applies to businesses significantly affected in Modified Stage 2, specifically in Toronto, Ottawa, Peel, and York region, as well as in the control and lockdown levels outlined in today's framework. Today, we are sharing the details about how businesses can access this financial support. Beginning November 16th, businesses will be able to apply online for property tax and energy cost rebates. Reimbursements for these costs will start to arrive this month. Those employers will have their bills covered for the entire time these necessary restrictions apply. They will be able to apply directly to the province through a single online portal. These businesses can expect to receive their rebate payments within a few weeks from the date they submit their completed applications. All they will need is their property tax bills and their energy bills, including electricity, natural gas, heating oil, and propane. Small business owners have enough on their minds right now, so the application process will be straightforward. If the public health restrictions are extended, businesses would be eligible for rebates for the next period. I do want to take a moment to thank my colleagues, Minister Rickford, Minister Thompson, Minister Fedeli, and Minister Sarkaria for their efforts to make this support available. Supporting our small businesses is truly an all-of-government effort. Our property tax and energy rebate program will complement the federal government's proposed new Canada Emergency Rent Subsidy. I was very pleased to see the legislation for that program introduced yesterday, and I'd like to ask all federal parties to work together to ensure that this support is made available as quickly as possible. Once again, we are pleased to work in concert with the federal government to cover the fixed costs of impacted businesses. This is another example of how all levels of government are coming together to deliver meaningful support, much needed relief for our businesses. All of us know a small business owner struggling as a result of COVID-19. We see the anxiety in their eyes when we get a haircut or visit our favorite restaurant. Across the province, people are demonstrating their Ontario spirit by doing what they can to support businesses in their local communities. Today, our message to these small business owners and to the people of Ontario is simple. As COVID-19 continues to create challenges, we will continue to support you. Thank you.
We'll go to the phone line for questions. First question, please.
First question comes from Ashley Legasic at News Talk 1010. Please go ahead.
How you doing, Ashley?
Ashley? Next question.
Next question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Mike. How you doing?
Hi, Premier. Thanks very much. I'm fine.
Thank you.
Hope you're well. Can you explain the rationale behind why the criteria for being in the orange zone is so wide, a test positivity rate all the way up to 10%? In other words, can you explain why you wouldn't put stricter measures in place, the red zone kind of measures, until a place was seeing a positivity rate way above 10%, which seems a lot higher than what the province had indicated was a threshold of concern before?
So I'll pass it over to Dr. Williams. But Mike, I found something out about you today, which is real positive. You love numbers, you love dashboards, and I hope you appreciate the dashboard that Peter Bethenpalvey, Minister Bethenpalvey, has worked on, because I'm a numbers guy like you. So hopefully you approve of that. If you want to do any tweaks, by all means, we're always open to your advice there. So I'll pass it over to Dr. Williams.
Yes, thank you, Premier, and thank you, Mike. I know you're good at the numbers. What I would say is that as we've gone through this process, and it is a learning one all the way through, as you recall, we had our original division between the orange and yellow was at 25, and you can see that's moved up to 40, so we have actually moved the baseline up. We saw that some of the impacts of some of the restrictions were not that extensive in the 25 to 40, so it would fit better in the protect level. As well as we saw in the 40 and above, the impact of the numbers going up to as high as the low 90s, which some are in at the moment. The effects beyond that are not extensive in there. So we've set that range between over 40 and up to just under 100 in that, and including the percent positive you've noted. So this has been a learning thing as we've seen how it's worked through in consultation with our tables, as well as the local medical officers of health, to see what is the impact on the public aspect in those various ranges. So that's what we've done. We've narrowed it in one way and expanded on the other side.
Follow up?
Back to you, Premier. How about wording the question this way? Why are you loosening restrictions in all of these various public health units when case numbers are still continuing to rise around the province?
Well, I'll tell you, when we look at the dashboard and we look at the numbers, there are some positive areas. We see a little bit of a flattening. We see what's happening in Ottawa. They're doing extremely good. If you look at the number of cases compared to other regions, to the exception of the eastern provinces, you know, we're leading the way per 100,000 cases, and especially compared to North America. So I think everyone has really done a great job here in Ontario. But again, I'm going to have to pass this over to Dr. Williams.
Yes, and it was a critical question for us as we sat down with our, as you know, most of the provinces in the so-called prevent level. We have a few in the now the new protect level, as the Premier has outlined, and some borderline there. We talked with the MOHs from the 4 leading ones, and we looked at the different aspects of how the modified 2 level, while it has had impact, they all felt it has helped slow the rise in their cases. In the case of Ottawa, they seem to be making rapid progress and coming down. That is our hope and aspiration that will continue to move down. Some have plateaued and some are still going up a little bit, but not as fast as they were before. So there has been impact. At the same time, all 4 MOHs agreed ongoing closures of these various institutions has impacts on economics and on individuals. And like all public health physicians, they're concerned with the social determinants of health and know this ongoing closure is not going to be helpful. So while we're opening up those aspects there, you can see with the framework, we've put other limitations all the way along. At the same time, with Minister Bethenpalvey's site coming on forward, and we're going to be putting that data to the public, we're asking the public to be even more engaged on your personal risk assessment so that you're going to have to assess each in your settings, knowing what is there and what is in place. What are you going to do as an individual, as a family, as with your children or loved ones to protect yourself? Because we want to give that decision making over to you. But in order to do that, we have to make sure you're informed, kept up to date, and we have a lot of communication issues to work centrally and with our fellow MOHs out in the field. So the work is ahead of us because we want you equipped to handle these changes as they go forward.
Next question.
Next question comes from Ashley Legasic at News Talk 1010.
Hi, Ashley.
Hi there. I'm so sorry about that
That's
earlier. With this new framework, Premier, heading into the winter months when we're going to be inside a lot more, and now the option for indoor dining will be available for the hotspot regions, can Ontarians feel more confident or more safe? What adjective would you use to encourage Ontarians to get back out there and support local businesses?
Well, I think this dashboard is going to give you a little sight on where your region is at or where it's heading, and it's preventative maintenance, as we call it, or continuous improvement. We're always trying to improve in the sectors. But again, we have to be super cautious, Ashley. By no means does this mean we let our guard down. By no means do we, have these big parties. We have to really tighten things up still, because we're in a real battle right now. But again, I think everyone in Ontario is doing a really good job. And I apologize to the media today, but I got to pass it over to Dr. Williams again. He understands it, or Minister of Health, either one of you.
Yes, and thank you for that question, because it really gets back to the key point we're trying to emphasize here, and it's something in public health we call harm reduction, and that's a principle we have. And that means then, for you to feel safe, one, you have to know in those various places you're going to go to, be it a restaurant or a gym or otherwise, in the level you're in, and we're going to make sure that data's out there, what are the steps and things that need to be in place that the owner of the place is going to put in to bring about their requirements for safety? And you need to monitor that. At the second time, on the second line, you have to know in the area you're in. If you're in a prevent zone with a positivity rate of 1% or 1.5, if you're in a group gathering of 20, 30, 40 people, what's your chance of coming in contact with someone who's positive? Maybe asymptomatic, doesn't even know they are. What if you're in 3 to 4%? Or if you're in 7 to 8%? We'll give you some information that you need to assess that situation, that while the retailer and the different settings are doing all they need to do, you need to make that decision yourself also to say, am I still comfortable to go when it's at this percent or this percent? And furthermore, by doing my part to not make contact, by my part and my family not making contact and not becoming a case, if everybody is it, then we move ourselves down from the orange to the yellow to the green. We can drive it down collectively together, and that has an investment of the public writ large. That's part of the principles around harm reduction. And so your safety is something that you see, you assess, and you evaluate, and you take the steps accordingly because you're going to be informed.
Follow up?
Thank you so much for that. In the outline for public health measures, do I understand correctly that pretty much no matter what level we're at until we have a vaccine or treatment available, the maximum amount of people at, say, an indoor social gathering will be 10 people? And have there been any conversations about revisiting social circles in this framework?
We haven't looked into that right now. I think we're going to continue on with the measures that we have, and continue on making sure that we're following the protocols and procedures. And I wouldn't encourage anyone to have larger gatherings than 10 indoors. It's absolutely critical that we stay vigilant. We cannot, I repeat, cannot let our guard down, or we'll be in the same boat as Germany, France, UK, so on and so forth over in Europe. It can turn on a light switch and bang, we're in that spot. So. But again, I want to emphasize the great job everyone's doing. We put together, as a province, as a people, we've done over 5 million tests. That's impressive. There was a game changer yesterday, and I don't know if people really appreciate what we did yesterday, from 2.75 hours of care and long-term care up to 4 hours. It's unprecedented. And with the dashboard as well, it's unprecedented transparency. I would say it's probably the best dashboard in the entire country. So we're leading the country in so many different areas. And again, it's not me, it's not the team, it's the people out there of Ontario. Everyone's pitching in. So again, I'm grateful for everyone's support out there.
Next question.
Next question comes from Cynthia Mulligan at City News. Please go ahead.
Hi, Premier.
Hi, how you doing, Cynthia?
I'm very well. How are you?
Good, thank you.
So it seems to me, and I'm kind of touching a bit on what Mike Crawley was trying to point out as well, it seems to me that overall you're raising the bar to have tighter restrictions. So for example, in the red zone control, which is the equivalent of a modified stage 2, you're looking at a 10% positivity rate. Across Ontario, it's about 4 right now. So that's really raising the bar in raising restrictions or increasing restrictions. We just have to accept that here and live with it and get the businesses back on board? Are you starting to put greater emphasis on business now than actual prevention?
Well, I'm always number one is prevention, and this gives us a tool that we can really react and prevent the spread when we see it going into certain regions. Before, even the region, wherever it went, everyone would start reacting when, we saw the numbers going through the roof. This will help us prevent that. It will help us to put the procedures and protocols in place before we hit that level. And going to your other question, are we going to live with this for a while? Yeah, I think the whole world's going to live with it for a while, at least until they come up with a vaccine that we can use. So in the meantime, we're going to be very, very vigilant. We're going to make sure we always ramp up the inspections, make sure people follow the protocols, and most importantly, we're going to work with the regions and more of a regional approach rather than a blanket approach. I'm not too sure whose noise that is in the background, but anyways, that's what we're going to do, and we're going to continue being very vigilant. But we also, as Dr. Williams said, you got to look at the social aspect of people's lives. I hear it, Cynthia, every single day, more than once, about restaurant owners, calling me up, and it's heartbreaking, believe me, and how they can't pay their loan and they may lose their house, and man, like that weighs on you. And then how do you measure that too? Of, again, depression, mental health, addictions, so on and so forth. We're just trying to get back to as normal as we can. And I think they've put together a great dashboard, and I always encourage yourself or anyone, be it Mike or anyone, to tell us, hey, maybe we should tweak this or tweak that. And we always take the advice. And the other area we look at is around the world, what other people are doing. I really liked the Pennsylvania website. I thought it was very impressive, and we take the best ideas and the best practices off other regions and bring them into Ontario.
Follow up?
Thank you, Premier. I'm wondering why schools are not mentioned at all in these new guidelines. I mean, today we have 54 more students age 9 to 13 testing positive, 48 in the 14 to 17 range. These kids are going to go home. They're potentially going to give it to their families. Why is that not mentioned or included in this as some sort of way to mark things and lock things down if necessary?
If I can pass that to Dr. Williams, I'd appreciate it. Thank you.
So the example you've given is an excellent one to make a point. The schools are in a different area. We have opened those up with a lot of protection in place. We've added more staff at all levels. If Minister Lecce was here, he would outline them all to you. We've added our public health nurses, enhanced that role as well. There's PPE and there's various cohorts. I think in your comment, which we have, and that's an interesting one, 54 students coming to the school. We find that again, we do our follow-up investigation, they came to the school COVID positive. Sometimes when we follow up later, it is actually already in the family. They probably may have gotten it from the family or from other community contacts. So far, we've been able to do that limitation at the door, limit contacts within the school to the class cohort, sometimes limit testing in that line. As a result, this past week, we've had no schools closed outright due to outbreaks. But I think what you're getting at is what we're concerned about is that why are so many coming in? And we find more coming in where there's the high level of positivity and a high level of community transmission, especially in the ones that we had on the modified zone 2. That means if we do a better job at protecting and keeping ourselves from getting COVID, our children won't get COVID. They won't bring it to the school. Less chance of the school being investigated, less chance of it being closed. the same effects. We see the same thing in the high numbers. People coming in, go over visit and come in and positive into the long-term care facilities. The better we drive down these numbers to get back down to prevent and protect, the less risk there are for these vulnerable populations. We can keep them open. We can do our best. We have our checks and balances, but the better thing is not to have it occurring at all, and that's why this step with harm reduction is so critical to bring those numbers down.
Last question.
Last question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. Can you hear me okay?
Yes, I can.
Okay, good. Thank you. I'm just trying to get a bit of clarification. You were talking last week on whatever was going to be in this plan would allow health units to be a little bit more surgical within their regions. So you gave the example of Etobicoke, up northwest corner where there's a lot of cases versus maybe somewhere around Bloor and Islington where it's not as bad. What is in here that allows you to adjust for that, or is that up to the health unit?
Yeah, I'm going to have to pass it. And guys, I really apologize. I know I've been passing it, Dr. Williams, but he's a lot more knowledgeable than I am when it comes to the health issues. So I'll pass it to Dr. Williams again.
Yes, well, Rob, I hear the term surgical, and it means many things to different people. And what you're asking is that are there steps in a health unit region under a public health unit, which is a geographical area, not the building, that a medical officer may choose to take some steps above and beyond what we put in. They can do still Section 22s. If they feel they have to deal with a certain venue, a certain aspect, they can do that if you use the word more surgical. If it gets down to in the areas within there, sometimes it may make sense if there is large geographical spread that there is a little mixing between the two. But if you put it in zones like that, like the example you gave, if it's red, if it's orange on one side of the street and yellow on the other, it really opens it up for a lot of confusion with the public. And so we're asking them to look at that. They're thinking about it, but that's not their recommendation at this time, because the key thing is to get the overall messaging, because in a place like Toronto, while there are people in Etobicoke with transit system, there's a lot of mixing and moving around. It's very hard to demarcate that very clearly. But there is messaging you can do in there, targeted messaging, targeted communications that the medical officer health may choose, as Dr. DeVille has already done, to bring that forward to the attention of the community in that area. That would give better emphasis on further harm reduction methods and education for the public in that location. But that's the level we're talking about at this time.
Follow up?
Okay, yeah, and just looking at some of the specifics in here, I see things like the distance between patrons and gyms is being increased to 3 meters from 2, and it looks like restaurants and bars would have to stop serving booze at 9 instead of, I guess it was 11 for indoor, and 4 people at a table instead of 6 as it used to be. So how much difference are those changes going to make?
Well, the 4 to 6, depending on what level they're in, you're 100% right, Rob, and the 2 to 3 meters. Again, the health table want to make sure, or rather, error on the side of caution, which I don't believe it's an error, going from 2 to 3 meters. And they're just being cautious, and I think it's good. At least we can help these people out and get their businesses up and going again, and get the gyms up and going, along with the restaurants, in a very safe manner. And again, we cannot let our guard down on this at all. We're trying to, as I mentioned yesterday, Rob, we're trying to have this happy balance, and it's extremely hard, but we have to make sure health is a priority, bar none, over anything. Health and science comes first. Right behind it is the economy, to keep people's livelihoods moving forward and helping them any way we can. So we're doing everything we possibly can. And if I just wrap this up with this comment, there's so many positive things that are happening now. And COVID's a nightmare for the whole world, including ourselves. But we're finding cracks within the systems throughout Ontario, and we've brought it to the forefront. And that's why I said this dashboard's unprecedented transparency. And I've always told our team, what you tell me, you better get it back on the computer immediately, because I want people to know exactly where we're at. People want certainty to a certain degree in their life. Even if it's bad or good, people want to know where they stand, and that's what we're doing right now. But as I mentioned, we're going to have a much better healthcare system, a stronger testing system, a much better, 1,000 times better long-term care system. And we've made other improvements throughout businesses as well, supporting them. So with everything that's been going on, again, Rob, I look at the glass half full all the time. There's a lot of positive things that we're doing right now, and as a province and as 14.5 million people, I thank you. Again, look around the world, look at south of the States. We're leading every jurisdiction in North America, our size, population-wise, anywhere, and I give the credit to the people again. So thank you, everyone, for everything you're doing.
Thanks, everyone.
Thank you.